My name is April. I'm a sexual health nurse in the UK, and I work in an open access service that people can come from any walk of life, any age, any demographic, sexuality, etc., and they can come in to get free healthcare related to STIs, sexual health problems, contraception, etc. And I've been doing that for sort of over 20 years. I think what I've noticed in my practice is just things that didn't used to be that common. So, for example, erectile dysfunction in the UK, people would often go to their general practitioner, etc. Well, I'm starting to see very young men attending with things like erectile dysfunction, and it just made me think, like, what's going on here? What's happening? And I just became interested in sort of porn studies. I got interested in Gail's work, and I started to sort of connect the dots a little bit. And I think with the young people that I see in clinic, I just started asking questions when I was doing their blood pressure. And I'd sort of say things like, oh, has anyone ever done any of the choking thing with you or anything like that? And they would just answer just really sort of nonchalantly, like, oh yeah, like all the time. Yeah, it's just a thing. Like really kind of not really, I guess, even understanding. We've talked a lot today about how, people don't know what they're consenting to. They think they're consenting. That's how they talk about it. And even the guys who are coming in with like sort of erectile dysfunction, I know some of my medical colleagues would go straight in there and sort of do a whole workup about looking at hormone profiles, blood pressure checks, stuff like that. Whereas my first question was always, oh, do you want to talk about porn today? And straight away they would open up and say, well, yeah, that's kind of why I'm here. That's why I've got this problem and that's what I need help with. Like literally straight away, like you ask the question and it would all come tumbling out. And I kind of found it really interesting that, like, despite the current sexualized culture that we have in society, I think pornography still appears to be sort of really shrouded in silence. It's still quite a taboo subject. And I feel that actually people, particularly who recognize themselves that they have problems, they want to talk about it, but they don't necessarily know where they can go and who they can talk to about it. So I thought, okay, in our pro forma, when people come in, we do a sexual history, we ask set questions, we ask about sexual assault, we ask about domestic violence. Let's ask people about pornography. And I don't know anyone else in the UK who's doing that routinely, so I added it into our pro forma. And straight away, half of my team started asking, and they got all sorts of rich information from patients. And what we found is that those patients who were asked either really wanted to talk about it, had lots of stories, things they wanted to tell us about it. Some patients sort of said, oh, can I ask why you're asking about that? And were quite interested by the question because they didn't necessarily understand the relevance. But once it was explained, oh, we tend to see these problems, we're like noticing these trends, suddenly people connected the dots and started talking about it. But the other half of my clinician colleagues said, we're not going to go there. I'm not asking those questions, and literally wouldn't ask them. So I did some research. I've been doing a research project to look at, actually what is the evidence about, people wanting to talk about this? Are clinicians ready? Are patients ready to talk about it? And I just found out lots of information about basically clinicians don't quite feel ready to talk about it. And I can sort of explore that a bit further in a moment. And actually patients often do, but they need to be asked the questions, they need to be prompted, and they need to feel that it's a safe environment. They're not going to be shamed for talking about it. They're not going to be made to feel embarrassed. And so, yeah, I guess the difference, and sort of back to the question that you're asking, I think I've just tried to start raising the discussion and having a conversation. And I really hope to be able to demonstrate with the evidence that we're getting from patients that, people are ready to talk about this. They need an area to be able to disclose. Those particularly with issues want to be able to talk about it and want clinicians to be open to those discussions. So that's
Thank
kind of
you.
where I am.
Yes, great. We'll come back and discuss some of those points. That's great. Vian, what's your experience?
Thank you, Gail. My name is Vian Nguyen. I'm an obstetrician and gynecologist. And I would say I never thought that my career would have this intersection with hypersexualization in the porn industry, but with the opportunity to reflect on that, it makes a lot of sense. I would say over the last 15 years, taking care of women, I've seen how hypersexualization and potentially just exposure to the porn industry at various parts of their lives has shown up in different ways. So whether it's physical symptoms or emotional symptoms, as far as the reasons why they're coming in to see me, the more I dig, the more I'm learning that there are these moments in their childhood and in their early adulthood that have been impacted in some way from all the things that we've discussed today. And so on one end of the spectrum, I see patients struggling from like clear consequences of addiction, but on the other hand, end of it, there are the quieter, sometimes more damaging effects. So I've had several patients come in to talk to me about, what Dr. Sanchez just mentioned around comparison and it's almost impossible to just open your eyes and go throughout your day without having a moment of comparison and not being able to recognize it as the reason is very dangerous. I've had patients come in to tell me about their inability to have healthy, meaningful relationships now because of something that they were exposed to early on or that their partner was exposed to early on. So now they're grappling with relationship issues. And more recently, I've had patients come in and tell me about their own kids being exposed to porn. And a lot of times it's not about the child going to look for it, right? It's asking questions, being curious about their body. Very common question that I'll hear is like, what's an average penis size? Well, if you put that into, any search engine, that's just, a disaster waiting to happen. And so, I've kind of pivoted my career now really to focus on educating teens, both boys and girls, and finding, ways to really normalize some of the taboo topics that we've talked about. And I think, like you mentioned too, like I find that teens want to talk about it, but sometimes it's us, it's our side, the clinicians, the parents that are not well equipped to actually have the conversation so that it can lead them down to having normalized, healthy conversations. So that's really what we've been focused on is just how do we get to the teens younger, but how do we also equip the other folks, the doctors, the clinicians, the parents, so that we can have these conversations.
Thank you. Thank you. Heidi?
Yeah, so I can so relate to both of those experiences that were shared. I'm a sexual assault nurse examiner, and I specifically work with kids. So, I'm sitting with kids and teens and their families after a really traumatic experience. And oftentimes, without even prompting, we're just finding all of these disclosures that pornography was a part of this child's sexual assault in some way, shape, or form. But we have found the same thing that when we ask, even more disclosures come out. And so, kind of the work I'm doing is twofold. As a first line responder, I'm empowering my colleagues to ask those questions and say this is important, and then here are the disclosures we're getting. What do we do with them? How do we handle this in a trauma informed way? And I think I'm probably seeing the most probably extreme side of all of this. And so sort of what lit a fire for me to want to learn more and teach about this and sort of advocate or play a role in all of this is that I am seeing, this is not a trend that is going away, so many kids who are sexually assaulting other kids because of what they're seeing in pornography. And so, this is a trend we've been tracking for almost a decade now, and it's not changing. It's not that these rates are decreasing. In fact, you could argue they're probably increasing or we have more awareness around it. But we're just seeing so many kids who are exposed to pornography at an early age. They're watching it, then they're acting it out. And then especially with teenagers, which all of you are already have been saying today, is this is setting the sexual template for them. So they maybe think they're having sex with someone and it's this extremely violent thing. And this, partner is like, I didn't actually consent to these things. And this is really confusing. And I think I was sexually assaulted and I don't know. And so just massive amounts of sexual violence and confusion happening with teenagers too. So I think seeing those trends and even trends around self-exploitation with teenagers where they are sending pornography. People are saying, hey, you're hot, send me a video and I'll give you money. Like just these huge amounts of exploitation where they're like, oh yeah, totally normal. Everyone does it. Like something is not adding up here. We're seeing harm happen to children and no adults are talking about it, and we're not helping them navigate this really confusing space they're living in. So I think seeing all of these trends, sort of the other side of the work that I'm doing is I own a business where I have done a ton of teaching to healthcare workers, community partners, frontline responders, and testifying in different realms to just say, hey, this is what's happening to our kids. What are we as adults going to do about it, and how do we help them? So in a nutshell, that's kind of what I'm doing and what I'm seeing.
I mean, I think Mandy and I have been working with a lot of people from the medical profession, and we're building, as you know, materials. You've obviously been involved mainly for the child advocacy centres. But we've also got history of working with doctors, and I'm just amazed by how there is no real guidelines from any major medical group. Where is the medical profession? I mean, because, and I've been told by a lot of people that the nurses, the frontline responders, know what's going on, and it's the pediatricians who are sometimes closing it down and don't want to discuss it. And I feel this is a terrible dereliction of duty, because, I mean, what is the job of the medical profession if not to put out, guidelines, white papers, protocols? I don't think there's protocols anywhere, really, is there, that have been written about what to do about pornography. I don't even know. I mean, yeah, there's no protocols, and it's up to you, basically. You're not asked to do this. So, I mean, what's stopping them embracing this reality? Because there's so many, mainly women nurses, speaking out, and yet they seem to be meeting this wall of resistance from the medical association. So, could you talk about that a bit? What you're seeing, if this is happening to you? And
I think, so from my point of view in sexual health, so again, like I say, I think working in sexual health, we talk about difficult topics all the time. We talk about subjects and sexual things that most people would find really embarrassing to talk about, and yet it rolls off the tip of our tongue. And so I've been really surprised by how my colleagues have not been keen to embrace this topic. And I think having explored it some more, so it's really interesting. So BASH, which is one of the British Association of Sexual Health, who draw up a lot of our guidelines, they write the kind of guidelines on how to take a sexual history. They do refer to the fact that clinicians in sexual health should identify unmet needs related to sexual dysfunction and difficulties. But they don't actually tell you how to ask. And I think the thing with medical people is that we like to know what is the right way to get the right answer. We don't like getting things wrong. I think lots of my colleagues talk about opening a can of worms and not having anywhere to send people. So I think one of the biggest problems we have in the UK is that if a patient said to me, yep, I've got a huge problem with pornography, I really want help, there's nowhere to send them. They're like mental health services in the UK are oversubscribed. They're a very limited kind of provision. And so I think it's very difficult to explore something with someone and then go, but there's nothing I can actually do for you. I think maybe the nursing model is we recognise that actually there's a lot of value sometimes in just talking about things, and actually a lot of patients don't necessarily want you to do anything, but they are happy to talk about it, and it's a bit of a relief just to explore something that they've had sort of on their shoulders for a long time. But I think, yeah, that's one of the problems, is that exactly as you say, Gail, there is no accepted knowledge or best practice or evidence about how to explore, what questions to ask. And I think what my research showed is that that's what clinicians want, and that's what would support them exploring this with patients. So that would be a really good next step, I think.
Before we move on, I just want to say one thing. We have the same problem in the United States, is that we get emails all the time from mainly men or boys or parents saying, you know, I'm addicted to porn, I can't stop, I need help. We don't know where to send them. We don't have, there's nowhere I know of the major psychological associations give actually training in this. And in fact, some of them are actually do not see porn as an issue. And that's, we're also hit up against that. So you really do feel, I know when we read the emails, is what do we do? Because we've got nowhere to send them. And some people suggest sex addictions counselling, but I think the best thing I heard from Gabe Dean, who was a former porn addict, he said, I wasn't addicted to sex, I was addicted to pixels, and it didn't work for me. He went to sex addiction counselling, and it was, you know, not what he was addicted to. In fact, he ended up saying he couldn't have sex. He basically had problems with erections, ejaculations, etc. So that's a very big issue. I think that's standing in the way. Is we don't want to open up this kind of worms because we don't know what to do about it once we've done that. Yeah.
And I think it's chicken and egg, isn't it? Because I liken this problem a little bit to, like I've talked before about, you know, it's a bit like back in the day, we didn't want to ask about domestic violence because we didn't want to upset anyone. And, you know, there weren't many services for victims of domestic violence. So it was just, again, shrouded in secrecy. Whereas now, again, in my service, we routinely ask everyone. It's a really easy question. We explore it. There's loads of services available. And so I feel we are there with porn. And yet until you start answering the question and getting the data, it's really hard to prove that you need services. So, yeah.
I think looking at the domestic violence is really useful because it used to be seen as a private issue. You don't talk about it. You know, we know she's got a black eye, she's got a broken arm, but it's a family issue. And then it exploded into a public health issue. And I think we're getting closer to pornography, problematic pornography use. And I know we use that term, but I don't know if you can use pornography in a non-problematic way if you're a kid. I think we're going to get there, but what's lagging behind is the research, the knowledge. And again, until you've got research in place, it's very hard to ask the medical profession to do anything. I'm interested to hear what you two think.
Yeah, I'll add that, you know, all of this has been very humbling experience. I think Jenny in the comments area is correct that many physicians, clinicians, we don't have the education. We're very poorly educated and aware of what's the harms of pornography. That's one big piece of it. It's not in our existing medical education. The other big piece of it is that the consequences and impact and the domino effect of, you know, the early exposure to porn causes so many other issues that we've alluded to before, whether it's anxiety, depression, marital problems, all these other things that are in front of our face that we're trying to deal with. So every day it's like that 15-minute appointment slot becomes 7 minutes of what are we going to try to address. The reality of trying to introduce, you know, the screening becomes almost impossible. But that's where we do have to look at our care teams. We do need to look at our nurses. How can we not just rely on that one clinician to do kind of things that are impossipartum?
Exactly.
I do believe that we're moving towards that direction. And similar to your example of domestic violence, April, I feel the same way with postpartum depression. We were not asking about postpartum depression 10, 15 years ago when I first started, and now it's a part of our regular routine. So I'm very hopeful that we need these types of events and we need these types of like advocacy so that we can push the screening. And we may have to be okay with screening and then having positive screening and not knowing exactly where to go with it so that we can be aggressive about finding those resources for the patients.
I had a very interesting experience with the CDC where we went to the different campuses. I was with a doctor, a psychologist, and me, and we were giving talks. And where this really grabbed hold was actually the field I didn't know existed, which is called adolescent psychology, adolescent medicine. And it's a small but growing field. And after that, I mean, just all of them came at me. And the reason is that they've been brought up in the porn culture, and they had learned in certain classes that porn was, you know, freeing and liberating. And then they ended up in emergency rooms doing their training and stuff and were seeing the other side of exactly what pornography was. And so they were very open to it. And that was very hopeful that the younger doctors were realizing that the culture that they've been brought up in is having a profound effect in their on their work and who they're seeing. Heidi?
Yeah, so I think that there's three things that I see a lot when I'm training healthcare workers or talking to them about this. And the first one is just a massive lack of awareness. I was training a multidisciplinary team a couple of months ago, and we had forensic nurses, medical providers, detectives, social workers, anyone who interacts with kids who have experienced some kind of sexual violence. So I talked about pornography, you know, all of the things that we know. And afterwards, so many people are like, I've never thought about that. So if all of our teams who are investigating sex crimes, treating people who have been impacted by pornography in these really extreme ways have never even thought about the impact of pornography, then of course we're not having conversations about it or asking the right questions, right? It's not even on anyone's radar. So I think that's sort of the first thing. But then the second thing is just fear. So I think for a lot of healthcare professionals, it's like, you want me to do what? I've never, just like you all are saying, I've never been trained on this. I don't know what to ask. We don't have a validated screening tool. What if they say something I don't know how to respond to? We don't have resources. It's exactly what both of you are naming. And so I think
don't know about porn as well. Sorry to interrupt you, Heidi, but also like lots of my team are like, I don't know anything about porn. I don't watch it. And
I can't talk about it.
Yeah, so I can't talk about it because I don't. Yep. And I think what people are saying is you don't need to know about porn.
Exactly.
I don't. Yeah.
Totally. Yes. It's exactly that. So it's all this fear that comes up. Then it's like, well, then I'm not going to do it because I'm freaked out by this and I'm not equipped. And I just wanted to work in an emergency department. I didn't sign up to be a social worker, right? Like I hear that kind of stuff. And then I think the other thing I see is almost this rationalization. So I've had professionals say to me, I look at porn and I've never sexually assaulted someone. Okay. So we don't like, you're pulling out the most extreme cases here. We don't need to go there because if we think about it, a lot of our colleagues probably do look at pornography, right? So now I'm asking you to engage with this with our patients. If this is happening in your world, there's going to be a dissonance there. And so I think sometimes we get this pushback of like, it's not that big of a deal because I look at it, it's not affecting me in negative ways. So I really don't want to address this with my patients. So I would say those are kind of the top three barriers I see most often with healthcare professionals.
So can you talk about the effects? I know we've talked about erectile dysfunction, but can you discuss the other effects like anxiety and, you know, because it goes a lot beyond addiction. It's on a continuum with addiction being at the far end, but I mean, along the way, you're seeing all sorts of effects. So can you talk to those?
Sure, I can jump in and I would love for both of you to also add in. There's so many and there is a ton of research around this, but you know, we know there are mental health effects. It can create anxiety, depression. It interrupts relationships. So kids who look at pornography are more likely to have disturbed relationships with their peers, with their families. We know it influences sexual violence. So kids who view pornography are more likely to be juvenile sex offenders. And actually kids who look at pornography are more likely to be sexually assaulted. So kind of both things are going on. We know it creates massive body issues. So just that comparison piece that Vian was talking about where, you know, kids are looking at pornography and saying like, my body doesn't look like that. What's wrong with me? We know it can influence eating disorders. I mean, self-harm, exploitation, we know it's a huge factor with sex trafficking, with grooming. I mean, I would love for you to both add in, but like the negative ramifications are massive. Yeah, I'll let both of you jump in with other things that you're seeing.
Well, I'll just say that what I think is even more concerning than everything else that's been already surfaced is that the impact, Heidi, that you just kind of rattled off, it shows up in anyone's office, you know, for any type of appointment or chief complaint. It's not so obvious, right? That it's because I was exposed to this earlier, now I'm dealing with this. I think that for me has been the most challenging to uncover basically just through experience, and then see it over and over in patterns of the women that I see as patients. They're coming in for one thing, and then we figure out that it's really the root of it was something else. And 99% of those things, they're preventable. And so I know that we can make a difference and we can make an impact. But I think that to me is the scariest part, is that how layered it is, and it's not so obvious what the root of it was.
Yeah, I think there's lots of evidence to say that porn is linked to various sort of physical and mental health things, all the things you describe, but people often don't link them. And I think men are particularly often quite slow to connect their pornography use with, you know, compulsive disorders or depression, low mood, etc. And again, it's not until you have those discussions and you kind of actually help them connect those things, actually, that, you know, that can be a real light bulb moment, and actually recognizing that that's the aspect that I need to address, perhaps. So again, I think it's about, you know, starting those discussions can just be sometimes so important.
It's a question. Mandy, do you want to?
So there is a question in the chat about if anyone has any experience or research in the area of working with parasympathetic nervous systems or the ventral vagal system to help patients get into their bodies when it comes to that.
I have not. I don't have that experience.
That's a great question, because
Yeah.
that really is where it needs to be, in the body.
Yeah.
It's in the body.
I think it highlights like the push to do that. You know, if we don't have any research, or if we don't know of people doing that, we definitely need to. We're talking about connection and reconnection, and we talk about it being in the heart and our value system and self-reflection, but there is some research talking about if we connect with ourselves, like what that looks like parasympathetically.
And I think continuing on, that the mention here, sexuality lives in our bodies and we need body strategies to heal. I mean, I think many medical, well, not many, but those who are sort of getting up with the research are beginning to realize just how much, as Bessel van der Kolk says, the body keeps the score. And that working with the body is critical, and that there's not much body work done around this. And in fact, again, one, I think, loses touch with the body, does not be able to understand their own body, and sex becomes performance rather than an actual embodied experience. And you know, how are you going to get doctors to start talking like that with an embodied experience?
I think it also, I think trauma plays a role here. So we do have some really great practitioners that are focusing on parasympathetic nervous systems and talking about trauma. And if our idea, you know, if what we say is that porn traumatizes, it creates a level of trauma, especially in young kids, then we can't do anything unless it's a trauma-informed response. And that has a lot of body work implication to it.
Yeah. Well, we always say, you know, Culture Reframed, even if a boy goes looking for pornography, you know, 11, 12, he's not expecting to be catapulted into the world of mainstream pornography. He thinks maybe he'll get lucky if he sees a pair of breasts or a naked woman. I mean, imagine what it does to that boy who has probably had no sexual experience, for his first experience to be catapulted into Pornhub, where women are being, you know, strangled, called all names under the sun, penetrated by 3, 4, 5 men at the same time, ejaculated on. I mean, just imagine what it does to his nervous system as well, and how it is a traumatic event for them. And then what we know is one of the things that trauma does is it limits your capacity to speak the trauma. And so who are you going to speak to? And the shame you feel, because the pornographers are very smart. They say things like, we know what you want and we're giving it to you. Are you man enough for this? So they're pulling him in to tell him, you want to be a man in this culture? Well, this is your rite of passage, is pornography. So even if he's got that toxic mix in his stomach of, you know, trauma, arousal, fear, he's going to be going back to it again, and the trauma is going to make him go back to it, because that's what happens, is you reenact often trauma if you've not dealt with it. So I mean, you know, we need all this trauma-informed work to be done. And you know, if we could sort of wave a magic wand, one of the first things I know that I would do would be to open up a school that trains psychologists in this, so there is somewhere to send them, because again, that's, as I said, a major blockage in this. Trauma and stress releasing exercises, brilliant body work, conceptual sexual abuse. Yeah, absolutely.
I just wanted to mention something that Heidi said, and I hear it so much, especially when we train law enforcement, maybe. I didn't sign up for this. This is not, like, this is not my job. I'm kind of one of those, like, I'm just going to put that off and put that off. And it's just like, it has become your job, it has become your job to, if you're in child protection, or if you're, in this field, it has to become your job. So not only do we need to destigmatize the conversation, but really implore, and I think that from working with the working group of professionals and medical professionals and those in law enforcement and forensics, there's really a push to say, no, this has to be your language now. This is what's happening. And you can blame pornography for that if you'd like. You can blame the industry if you need someone to blame. But the fact is that this is now our job. And this is what we do have to address, because if everyone keeps burying their heads in the sand or doing the not my problem, not my job, then this is where, we're going to end up with a generation of kids with a lot of trauma, with a whole lot of trauma.
And I think that's kind of also partly where some of my colleagues have come from, that there is an expectation now that in a consultation about, for example, a woman getting a contraceptive pill, we have to address safeguarding things, we talk about sexual assault, we screen for domestic violence, and, that's before you've even started talking about her choice of contraceptive, etc. And our appointments are getting shorter, there's more patients coming through the door. And I think part of the pushback from my colleagues is actually, I would like to explore this, but to do it, you need to be able to, be able to have time, you need to let the person speak, you need to be able to have time to listen to them and to be able to respond to that. And, how do I do that in a 15-minute consultation when actually what they've come in for is their birth control, or,
Right.
etc. And I think we also have to be aware of the realities of that. And, how do we also, because I do think it's the right thing to do. And I do think sometimes that's the most important part of the consultation, is those questions. And I know my colleagues believe that as well, but also the realities of it is how do you make time for that? And that is I think a bit of a pushback. Particularly when I was doing my research, I was saying, actually, it's not just sexual health. People go to their general practitioner for X, Y, or Z health complaints, and that's also somewhere where GPs should be asking questions about this. And I don't know what my other colleagues on this panel sort of feel about the time pressures that we face.
Well, I think this brings us to why we called it breaking down the silos. Imagine if the kids were having good sex education that was exploring the harms of pornography. Imagine it was being in schools, that therapists were being trained in it, doctors and nurses were being trained in it, parents were learning about the harm. Then you're opening it up into a public health issue. At the moment, it's so siloed that it hasn't even gotten, from what you see, into the medical communities and also the legal communities. We find that when we speak to lawyers' organizations, these are family court lawyers, where so much is around pornography and issues of violence and harm, and they've never thought to ask these questions as well. So oftentimes an offending father who's got a porn addiction will get full custody, because she's, quote, hysterical and is making a big deal of it. So there are organizations of women all over the world now who are working to stop this happening, because it's called the Parental Alienation Act, where basically if you are accused of alienating your kid against one of the parents, then you lose custody. based on that. So many women have lost custody on this. I remember one woman telling me that she found her husband's pornography on the internet, and in between all the pictures was a picture he'd spliced the head of his daughter on top of them. That was not seen as a reason for her to take custody of the children.
Yeah, April, what you mentioned about time constraints, it's so interesting because as we break down the silos and we talk to different professionals, it's kind of the same thing. Like teachers are saying the same thing, like, well, we only have a short amount of time, and and then CACs are saying, well, we can only train so much, we can only do so much. Law enforcement saying, well, that's not really our, and so I think that that's a really real thing. We do have to consider the lack of training, the lack of screening questions, all of these, the lack of support, for professionals to be able to do just basic, and we're always like, well, why can't you ask in a well child visit? And I talked to Vian and she's like, well, you have 10 minutes, like sometimes it's 7. And then after you do all that stuff, the parents are in the room, and so there's all of these, the constraints when we talk about prevention. We're not a prevention heavy society, is part of the problem too. But yeah, I think tackling that and being really empathetic to time constraints and lack of training and education and awareness, and just, know how to respond without feeling like you're going to look at me as not the expert, because we look to our doctors, and those in the healthcare professionals, as, the experts. And if you don't know how to address it, like Vian said, you're not going to talk about it. Absolutely.
I do feel just to say that I think however, this is where we were 10 years ago with domestic violence, and that's why I feel very, very positive about that, because look what we've done in that arena. The training is excellent, the performers are excellent, there is a lot of good support out there, and I do really feel that change is happening. This is the start of change, and that's really exciting. We're here today talking about it. Look at all these motivated people who want to make a difference, and that's what
and what was interesting about that was it was the feminist movement of the 80s and 90s that got domestic violence out there as a public health issue. I mean, they were the ones who started the first domestic violence shelters. They were the ones who saw it for the violence it was. And we don't have a similar group of sort of activist feminists fighting for this. That's one of to see pornography as an issue. In fact, one of the things that we have to deal with in the academy is a lot of the newly minted academics are pro-pornography. So, which is going to work against what we need, which is, newly minted academics and activists going out into the world talking about this, because that's how domestic violence got seen. It didn't just appear from nowhere. I mean, there was political activism around this. And I think we need to see ourselves not just as academics and experts, but as political activists as well, getting this on the books. Someone said they'd love to learn more, have anecdotal evidence of purity culture fueling porn use in churches. Anyone come across this? No. So what is interesting, there's a lot of studies that say, and this is how academics can get it wrong. So they studied, when they used to have hotels when pornography in hotels, what they found was that if it was a religious convention, the number of porn movies that were rented would increase. And so the argument that they made was A causes B, right? If you're religious, you're going to watch more porn. In reality, what was going on is that most men who were not religious were not buying the porn from hotels because it's softcore and it's not what they watch. They wanted the hardcore, so they take it on their laptop. But if you come from a more religious background, the chances of doing that are much more difficult. So actually, they got it sort of upside down in the study, and not understanding what was really going on was that hotel porn simply isn't doing it anymore for the average porn user.
So I want to be cognizant of the time. We have about 5 minutes left in the panel. So I would love to hear in terms of what's working for you or solutions that you can put forth, and really like where do we need to go from here in your particular fields. April, we can start with you.
I think what's working for me is more and more of my team are starting to feel empowered to ask. And they are, we talk about case studies, we talk about examples, and I think the more people hear about this, it's like a light bulb goes on. And we had Gail come and do some a conference for some of our team, and soon you can't unhear it and you can't unsee it, and suddenly you recognize that actually it's relevant to you and it's your practice, your children, your family. So I think it's getting the word out there. It's trying to kind of demonstrate good practice, and to disseminate that knowledge, I think is really important. And I think it's been really great being involved with Culture Reframed and like looking at, let's try and write some guidelines. Let's try and kind of get the evidence together. That's also been sort of really a really positive thing. So that's where I'm at.
Great, thank you.
Well, I think, seems to be so much forward acceptance from the UK clinicians. I've run into quite a few barriers with my just own colleagues here in the States. And not that I'm giving up, but I do believe that the barriers are quite high given our healthcare system, and what's not tied to a direct reimbursement basically falls to the wayside. And so as we work through that piece in parallel, what's been very interesting and rewarding for me is actually going direct to parents and families and letting them know, even as simple as the scripts Mandy mentioned earlier on Culture Reframed. I've used them. My friends and family have started to use them when they've come across the situation that calls for it. I think that is also very helpful, and it's helpful to see that the initial conversation may be difficult, but once people know the tools are there, they are very much inclined to use them. And so speaking with parents and families and speaking directly with teens, we're working on a few different things that we're just finding teens right on these social media platforms, like on TikTok and on Instagram, and trying to raise awareness around consent. Like, what does consent look like? How do you say no online? How do you say no in person? And teaching, puberty through these short video clips. It's our hope that being exposed can quench their curiosity, and maybe not so much that they go looking at other places to answer their questions. And so we're still early stage, but I feel like the reception has been good, and teens are, they're just difficult people. And trying to meet them on their social media platforms has been a good positive traction.
Well, I have had the great honor and privilege of being a consultant with Culture Reframed the last 2 years. So we've actively been working on different materials that will soon be available to healthcare professionals. So I think for me, that's so exciting, because that's the number one thing I get asked for. When I'm talking to healthcare professionals, like, do you have screening tools? Do you have a one-pager I could give to a parent? Do you have this? Do you have that? It's like, no, I don't have anything for you. So I'm so excited that in a few months, we'll be able to say, yes, we do have stuff for you. You can utilize in any healthcare setting. And I think it'll be incredibly helpful. We had a huge multidisciplinary team that helped us put this together. So just a lot of really brilliant, empathetic, trauma-informed people who came together from multiple countries, actually, to say, this is what we need in a healthcare setting. So, one pagers for parents, for teens, education for our colleagues, screening questions, just a ton of really, I think, incredibly helpful things that will help take away those fear barriers of, I don't know how to do this. Then we can hand it and say, it's super simple, follow these steps. So I think it's a really good first kind of steps into getting more people on board.
And it'll be on our website around late January, early February.
Yeah.
And it's specifically aimed at medical professionals. So I want to thank you very much for your comments, thoughts. this was such an important panel because we cannot leave out the medical issue, given that, as I say, we're breaking down silos and that we all want to be part of this. So I thank you for participating. And now we are going to finish with looking at solutions, because we thought we can't kind of leave you with this. And maybe, Mandy, just for 2 minutes, people should put in the chat how they're feeling just before we get to the solutions. Do you think that would be a good idea?
Sure. Sure.
Okay, so just, I mean, you've been here a lot all day. So before Mandy starts the solutions, do you want to just say how you feel? Upset, tired, angry, hopeful, overwhelmed? Will the recordings be available? Yes, you'll get an email. Sad, determined, not alone, shocked and inspired, inspired and hopeful, aware, empowered, burdened, yet also hopeful, tired but inspired, like I've become an activist, sickened but inspired, frustrated, informed, worried for the youth, motivated. I imagine my grandchildren will never be on the internet again. Empowered with information, informed. We all need to do our bit. Yep. Sad, but even more passionate about doing more. Ready to get to work again. There's hope and there's a long road ahead of us. There really is. It doesn't look like any of us will be out for jobs soon. So meanwhile, Mandy is going to open up with discussing some of the solutions that Culture Reframed has developed, and then we'll sort of open it up. We'd like, when Mandy's finished, we'd like you to turn your cameras on. Feel free to speak, comments, questions, just anything. So, Mandy.
All right. Let's go ahead. Okay, well, we are finally at the conclusion of this wonderful conference, and I'm so excited to share with you our public health solution that we have created and continue to expand on based on all of the experts and the testimonies and experiences that we've heard from everyone today. So again, our mission at Culture Reframed is to stop the emotional, behavioral, and sexual harms of pornography and hypersexualized media to children and youth. And we do this in 5 main ways. First, we're raising awareness. And I've heard that this is key, right? Raise awareness and shift that cultural narrative about the impact and the harms of pornography on young people. We do this by building resilience and resistance in young people to hypersexualized media and porn culture. We are continuously at the forefront of advancing academic research and the science around the 4 decades worth of research on the harms of pornography. We're also fostering institutional change to improve child protection and safeguarding systems. And finally, we're advocating for policy change to better protect young people from the harms of pornography. We believe that we do have this toxic culture, but we can actually use it to reframe and change it. And the ways in which we do this is first and foremost through equity and empathy. We work on an all systems level from the macro down to the micro. So at the macro level, we are trying to change public policy through education and awareness, but also through legislation like age verification, holding porn sites accountable, ending social corporate responsibility, changing the culture in which we see hypersexualized media just being so pronounced, and the society in which we're living in and our kids are growing up in. On that middle or meso level, we're working with schools, communities, and health agencies to better protect our kids, to be informed about the public health issues of pornography, providing porn critical literacy and education, sex education to schools and communities, and also providing, as Heidi mentioned, those much needed research and resources to health agencies. And then, of course, at a micro level, working on that level to influence family and peers and individuals to take this seriously, to dispel those myths that porn isn't that bad, and that something needs to be done. We are working on that micro level for governmental legislation and regulation that, as Gail mentioned, defines porn as non-state torture. A lot of our conversations about consent is wrapped up in this because you cannot consent to torture. There's UN treaties about this, and it holds true worldwide, not just in the US. We wish to hold porn sites financially accountable, as many mentioned today, that MasterCard, Visa, Google Pay, Apple Pay, you can all use those methods of transaction on these porn sites. So if we get them to reinstitute their bans or to get rid of that, it holds the porn sites financially accountable. And to do that, we need to withdraw the credit card payment systems on porn sites. Also, to end the corporate social responsibility approach of self-regulation by porn sites. As we've mentioned time and time again, what if we were to let big tobacco and alcohol self-regulate? These multi-billion-dollar industries cannot be socially responsible and held to regulate themselves, because this is what we see, the wild, wild west of the internet. And really, as John Carr mentioned, enforce age verification for both the production and the consumption of pornography. Again, we view pornography as a stealth public health crisis for children because of its pervasiveness as a societal problem. And this is why we're taking and encourage you to take a public health approach to this issue, because as we have seen, porn is undermining the social, emotional, cognitive, and physical health and well-being of our children. We at Culture Reframed center our work around young people and all of those trusted adults, from activists, educators, youth and family advocates, parents groups, community leaders, and those in the mental health, medical, and legal fields. We really want to empower and educate these people to help build resilience and resistance in young people to hypersexualized media and pornography by becoming knowledgeable, skilled, and confident in having these necessary conversations, not only with young people, but also with colleagues and parents. As Gail had mentioned, we are building partnerships with child advocacy centers, those in the domestic and sexual violence field, anti-trafficking organizations, schools across the country and around the world, and medical and legal professionals. We believe that it's with this awareness and education with these groups that is truly going to make a difference in the lives of our children. Because we know through research that these three groups are key protective factors in protecting children against risky behaviors. That once parents, caregivers, educators, and those in the medical, legal, and public health fields all are willing and ready to have conversations with kids, they're more likely to reduce those risky behaviors. So, as mentioned before, we have our online courses. They are research-driven and age-based. We have the 2 courses for parents that are also being used by professionals. They are full of educational resources, videos, links, research reports, and those guided conversation scripts that they are being used across the country and around the world. And they're free and accessible right now on our website. So these are some important topics that we cover in the Tweens and Teens program. Again, in the Tweens program, we're looking at kids aged 9 to 12, and we talk about things such as boundaries, consent, privacy, how to manage technology at this young of age, and then whether or not to give a child a connected device. What do we do when we do? Also, tips on navigating online and offline friendships for kids this age, and how as both parents and professionals and adults to lead discussions skillfully and carefully with this age group. And then in our teens program, we start out by focusing on all of those physical, social, emotional, cognitive changes that kids are going through, right down to the eye roll. We discuss healthy relationships. What's healthy about our relationships? What are some key signs? Or flags to look for, green flags that indicate that this is what we want is a consenting relationship. What is toxic about masculinity? How can it be toxic? How to spot it? What to do? Probably our most requested module is the one on sexting and the digital footprint with teens. We get a lot of educators downloading this module and covering it in their schools. Also on predators, human trafficking, and safety. Again, it's never too, I don't believe it's ever too much to talk about this, but never too early, never too late to start having these conversations with young people. What our research shows as well is that kids want to have these conversations. They want you to be a trusted adult if you're the parent. They want to have the space to find a trusted adult to have these conversations. And again, scaffolding that information, whether it's at 5 or whether it's in 5th grade, start scaffolding that information, talking about consent, boundaries, pleasure, what is good for us, our values, our human values, and also being present. This is probably the most important idea, is to be present with kids, understand what they are doing, watch for these possible warning signs, and knowing that these warning signs may look different for children depending on their age and stage of development. So if kids are starting to withdraw from friends and family, activities that they once liked, if they're closing their device, I always say if they slip their phone underneath their leg when you walk in the room, they may be planning a surprise birthday party for you, or there may be something on that screen that they don't want you to see. We have to be able to see that, to understand what they're doing. If they are spending excessive amounts of time in the bathroom and they do not have a medical condition that requires them to be in the bathroom for that excessive amount of time, take note of that. Sometimes I hear from parents, and I do this in my own home, we don't take devices into the bathroom, right? And none of us, right? Whether that's the adults in the family or the children, the bathroom is a space for privacy, and that phone should not be in there. If they are secretive about their online and offline friends, if they don't want you to know, or they're very coy about who they are, we advise parents to know what your kids are doing, to sit on the game with them and not just say, well, I don't know how they play, or I don't know what the big deal is about this. Let them show you how they play these games. For gaming in particular, we say it's great not to have a headset. You want to be able to hear those voices that are coming over the gaming systems or gaming platforms. Just as you would check out who your kids' friends are and who their parents are, if they go for a sleepover, we should be knowing who's in those chats. We should be knowing who's sending direct messages to our kids. Also, being aware of that lack of sleep, especially in light of Common Sense Media's research on notifications. If they're receiving over 200 notifications, that blue light is going off all of the time. So unusually tired, quality of sleep is lacking. This may be a warning sign that they are having some excessive social media use or pornography use. Particularly our medical professionals would tell us that if kids are starting to use precocious sexual language where they did not, and this is not just singing lyrics to songs, if their mood is shifting, if they exhibit depression, increased depression and anxiety, it's time to take notice and think about, ask the child what's going on. Again, take a look at our porn critical sex education. I do not think you will be disappointed in this. This is the QR code that you can go to our learning management system, where this is free. You just register for it. Again, it's innovative. It has an anti-exploitation framework. We think it's crucial to unpack what kids already know. Ask them and find out what they already know about sex and sexualization and pornography. in words that kids use, in the language that they use, so meeting them where they are. We give very comprehensive, science-backed and age-appropriate and developmentally appropriate lesson plans that are customizable, and those training modules for teachers are critical. So anybody can use this. This is full of resources and they're free. So our call to action to you from this conference and from Culture Reframe is to access and share our information, to talk about this, talk about how this is an issue, see where it comes up, observe what's going on, and sign up. Subscribe to our newsletter. This is where you will get all of the really cool information about our partners, what we're doing, the presentations, what legislation is coming about. We do interviews with tons of different people and really prop up that research. So if you're not already subscribed, please take a second and follow this QR code to subscribe to our newsletter. And we don't bombard you. So twice a month, maybe, and advertising important events. So again, this information is going to show up in the chat today and on your resource sheet. I'm sure that you've been to the website, but check it out. We've got lots of new information, lots of resources, lots of research. Our academic library has over 500 articles that are designed to highlight the harms and the effects of pornography on youth. And you can email us anytime if there are questions that you posed in the chat that you could not get answered today. We are happy to send them to the speakers. If you have questions for us that comes up tomorrow, over the weekend, next week, feel free to shoot us an email. We're happy to chat with you. And Gail, I'm going to end with you.
Oh, you're
Gail, are
muted.
you there?
There you go.
Can you hear me now?
Yep, got you.
Yes. So as we've seen today, the issue is not if your kid will see porn, it's when. And that we have very little control over this. We started with a discussion of algorithms and how kids are targeted. We went into looking at the effects, different groups of experts looking at it, activists. So the question is, if we don't talk to our kids about porn, the porn industry will. And the issue is, who do you want to have that conversation? A predatory capitalist organization who's interested in just getting your kid and just has no care whatever the consequences will be, or those of us who really care that kids grow up in a healthy environment where they can flourish and become healthy adults. So this is what we do at Culture Reframed. This is why we started it. We are science-based, science-driven, research-based as well, and we do stuff that a lot of other organizations in this space don't do, although there's lots of good organizations out there, and we do thank our partners. We also, because we are ahead of our time, it is difficult to get funding. And so we ask you to consider making a gift to Culture Reframed. This is not the best part of any of us as business people or getting money, but we'll be honest, it's not easy to raise money for this because all the discussion we had around people not knowing about this means that when you make an appeal or you go out a grant, people don't know why should I give money to an issue like this? It doesn't seem to be that big a deal. So because we are ahead of our time, we do need all the help we can get. So we hope you'll consider giving us, please, a donation.